Next, I'm going to conduct a thorax and lung assessment on my patient. I'm going to ask my patient to sit upright for me, and I am assessing their chest region. Actually, if you can go ahead and take your shirt off for me again. And I am looking at the thorax region for symmetry, making sure that the skin is even and intact. I'm also looking to see if the patient is having any respiratory distress and identifying the respiratory effort, that they're not using any accessory muscles or having any signs of tachypnea, shortness of breath. None noted. Do you feel short of breath, having any difficulty breathing? No. I am next going to assess my patient's AP diameter. So initially I am going to, just keep your arms, I am assessing my patient's anterior, posterior, and the ratio should be 1 to 2. So 1 to 2. If for any reason you do not have a ratio of 1 to 2, you would identify that your patient may be exhibiting some signs of barrel chesting, and you may want to further assess your patient for any signs and symptoms of COPD or hypercapnia, elevated CO2 levels. Next, I'm going to palpate my patient's thoracic cavity, noting any bumps, lumps, masses, tenderness. Any pain or tenderness when I palpate. I'm also going to palpate the posterior side of my patient, making sure that there are no tenderness, lumps, masses. Again, assessing my patient's thoracic region for any scarring, even hair distribution, color, texture of our skin, making sure that the patient doesn't seem to be dehydrated or have any scars from any invasive procedures. Next, I'm going to go ahead and percuss. I am going to percuss all regions to make sure I cover all lobes of my patient's thoracic region. Noting if what the different terms and sounds are. You may hear flat, dull, or resonance upon percussion. I'm noting that each region is equal. There is no abnormal sounds noted upon percussion that would cause me to inquire further about any masses or fluid buildup or anything additionally. There is resonance heard over all lung fields. While I'm back here, I'm going to go ahead and auscultate. Again, making sure that I auscultate all lung regions. You could just take a nice deep breath for me. I'm comparing each side. And I am noting that all lung fields are clear, and the patient was breathing regularly with no difficulty or use of accessory muscles. I'm going to go ahead to Again, begin percussing in the same pattern as I had conducted percussion on the posterior side of the patient. Noting resonance in all lung fields. And again, I'm going to auscultate. If you could just take a couple nice deep breaths.